I am really excited to have a special guest today. Her name is Dr. Stacy Greeter. She is a psychiatrist working in Sarasota, Florida. She is board certified as both a child and adolescent, as well as adult psychiatrist. She has extensive experience treating complex mental illness and unique family systems with special training in family therapy and motivational interviewing. Work with your strengths and collaborate with you and your family. They combine the most current evidence-based medication treatment with taking the time to fully understand your unique perspective and life story. They ensure that you achieve the best result with the least amount of medication. That's a lot of how I practice. I'm trying to
All
help
right.
them be in the best positions. Welcome to the podcast, Dr. Stacy.
Thank you so much, Michael. It's really great to be here. I really enjoyed meeting Michael at the APSARD conference this past January.
Yeah, it was great, and fortunately, time goes by too fast. Didn't get a chance to talk, but I forget because I think one of the opening afternoon sessions, and I think I may brought up being neurodivergent or
I
something
think what
like
happened
that.
was I was answering oh, wait. I was saying I was in support of reproductive psychiatry, and then they asked me to come up and they asked me about myself, and then I proudly showed my neurospicy sweatshirt and announced that I was autistic and ADHD. I am proudly autistic and ADHD.
And then I said, "Hey, do you want to come on my
Yeah.
podcast?" This is a podcast that ends up having a lot of people as we're learning
And
who
then I
are
was like,
learning.
what? I just got diagnosed with fibromyalgia too. What do you know? Small world.
Yeah, and then add to that. So, getting to the punchline, this is a really a unique perspective of you come from the many directions, right? You're have
Mm,
a history of, you're in the medical field trying to help care for people, and then you become a patient, and then also offering what it's like to navigate that. And I didn't get a chance to hear the story, and you said you'd be willing to
yes.
share part of that. But before we dive into
Okay.
that, I always like to get a chance to, when we have experts like yourself, what and also selfishly having a daughter who's still not sure what she wants to
Aw.
be when she grows up, and other people listening who might be still wanting to figure out what they want to be when they grow up.
Hmm.
How did you and why did you, what was your path to get into medicine and psychiatry?
Oh, wow. I was always fascinated with people from a young age. And looking back, I didn't know I was autistic until age 40, which, by the way, I am now age 40. So this year of my life is when I discovered I was autistic. But looking back as a child, I think part of how I survived was being a detective and really paying attention to other people's thoughts and feelings and perspectives to figure out what I was supposed to be doing because it didn't come naturally to me. I first decided I wanted to be a psychiatrist actually when I was 7 years old. My grandfather had Alzheimer's disease and died that year, and I was really curious about how a biological illness could rob someone of their mind, identity, and personality. And so from a very young age, I was curious about the fundamental biological basis of who we are, how we think, how we feel, and how that can be altered by illness. My grandfather happened to be a psychiatrist, so I was like, I kind of want to get to know this guy I never got to know. And so he had a bunch of psychiatric books too. And that was a very, I would say, young and maybe immature form of interest in psychiatry. I had no idea what psychiatry actually was when I was 7. Fortunately, I was able to gain more of a perspective of what it is to be a psychiatrist. And now my reasons for being in psychiatry are not the grandiose desire to find out the biological basis of what we are as human beings that I had as a 7-year-old, but instead there's nothing that I find as emotionally or intellectually stimulating as psychiatric work. It is impossible to be a psychiatrist and not grow yourself tremendously as I help people gain insights into themselves and gain compassion for themselves. I gain insights into myself and compassion for myself. So there's this, for me, I find the perfect mixture of like creativity, emotions, and the intellect all in one. And I just love it. It is my special interest being autistic too. So that helps. I get to answer patients' questions. I just get to info dump about my special interests of psychiatry all day too.
Yeah, and finding that you get to do something you enjoy
Yes.
and had an interest, and it's funny what we think it's like to be a doctor.
Yes.
We have no idea. You're 7, you know, you're trying
This
to
is
figure
very
things out.
true.
And I'm sure you would like to probably go through some of those textbooks and go, oh, it doesn't apply.
Doesn't apply. Yes.
There were no girls didn't get autism, women didn't get autism or weren't autistic,
Yeah.
and let alone ADHD wasn't even any of those textbooks. Probably, I don't even know if they
No,
existed.
I think they called it
probably.
minimal brain dysfunction.
That would probably been the 70s and 80s or so.
Right?
I had to come up with things. Well, even the word fibromyalgia is kind of just not a perfect word, but they wanted to change it instead of calling it all psychosomatic because that implied it was just something you could think your way through.
Yes.
Before we knew.
Yes. Or do I say, what pain doesn't actually fundamentally exist in the brain?
And it's a very slippery, careful how you say that because for many, it's a dismissive thing to say it's just in your head.
But I'm like, well, if you cut off a foot and you poke it, it does not feel pain. But at that same time, I hear you. We can talk about like top down versus bottom up pains. Okay. That there's the whole pain system, and that fibromyalgia is would you call it a top down pain?
Yeah. So there's 3 types.
Okay.
Nociceptive is tissue damage in the classic sense of what we think pain, right? You are having an infected appendix and you broke a bone, it's nociceptive. Neuropathic is diabetic neuropathy. You have some autoimmune vasculitis affecting the nerves, and you have a herniated disc that's being compressed in a very ridiculous. And nociplastic is within the central nervous system.
Yes.
They used to call it more centralized pain, but now the more updated way of calling it is nociplastic pain.
Yes.
That's how.
Yes.
And that's the stereotypical nociplastic pain, right? Chronic fatigue, POTS.
I have neuropathic pain too, that they haven't really been able to completely figure out either.
All of those are often overlapping Venn diagrams. You can have both, right? You can have osteoarthritis of your knee and have a centralized pain component.
I think that you were kind of playing off of what you were saying about patients being upset if you tell them that their pain has a origin within their brain. And I think we can do more as physicians to help with that stigma. I'll admit myself as a physician, before I was diagnosed with fibromyalgia, I had some biases about fibromyalgia patients myself. And I will admit that. And I think that this has been a humbling experience for me too. And I think that in the culture of medicine as physicians, we do a disservice to patients with pain syndromes of brain origin. And they are not any less real, or certainly not less painful, or somehow within the patient's control any more than other types of pain. Not that you can't do things to alleviate the pain. So you have agency, but you don't get to decide about the pain or how much pain is there, unfortunately. Any more than we get to decide whether we have depression or ADHD.
And talking about, you're saying this kind of a stigma about it before and getting diagnosed. What were your thoughts from a psychiatry perspective? Because that often is a medical diagnosis. I don't know if you've ever in psychiatry, they even would make a diagnosis that somebody has fibromyalgia. I'm guessing they would delegate that to a non-psychiatric specialty. Is that fair to say?
True. I don't diagnose fibromyalgia.
So what was the stigma, or what were your thoughts about fibromyalgia before?
I think overall our culture can see chronic pain patients as put them in the category of a needy, dependent, helpless, not exercising, not doing lifestyle changes. Like that's like the stereotype. What do you think, Michael?
Oh, I think that's
The
a
stereotype?
stereotype.
That's not accurate, but that is a stereotype.
And often that is, for many, the people who get diagnosed are the ones who have the most extreme symptoms, highest on the fibromyalgia impact score, and they've had them for the longest time. So somebody may think of, they don't want the diagnosis, because I remember my mom, and she was postmenopausal, and she got diagnosed in grandma, and all she did was sit around and complain and was in pain. She probably had fibromyalgia when she was 40.
Right.
They called it arthritis or
Mm-hmm.
migraines or had painful periods. But I just did a episode on stigma of fibromyalgia, and it was out of
Oh,
Norway.
great.
And medical students and doctors over the years were surveyed on what are the most prestigious illnesses. Every time, fibromyalgia was the least prestigious.
The least prestigious.
Anxiety was pretty close to being on the least, not quite as least prestigious part of things. And then there were premier things like having a heart disease and leukemia, and those things, I guess, are considered more prestigious, for example. But
Right.
and
Yeah.
so
And
a
that's
lot of
hard
times,
because people suffer a lot and they're not getting much empathy and they're not being validated, not seen. Suffering is hard enough, right, with pain. But to suffer with pain and to be not believed and not seen makes it so much more painful.
and what does that leave somebody to do if they're trying to navigate the health system?
Yeah.
It's a bizarre world from a patient's
It's
perspective.
It's tough. It's tough. And yes, a lot of patients, I help to coach them about advocating for their medical needs. Even going to a doctor, when I go to a doctor and I tell them I'm autistic, they don't believe that I'm autistic. That's okay. So I coach my patients, like, keep in mind your primary goal going in there, okay? And your primary goal is to get your healthcare needs met. I mean, it would be nice, it'd be super nice to be believed and validated and seen, but to not take it, to put your pride, put your need to be right or believed to the side as you walk into the door and really focus on what you need, the information you need to give and what needs need to be met by the healthcare professional. I hear from patients a culture in medical professionals where questions can be offensive. That part always confuses me because I love talking about psychiatry. I love questions. And I'm like, why see the specialist if you can't ask them some questions? Yet it's like some clinicians are more open to answering questions than others of why did you choose this diagnosis for me? Did you consider other diagnoses? Why did you choose this medicine? Did you consider other medicines? What were the other ones you considered? Why'd you pick this one? I think these are really great things to ask, right? But to kind of feel out the personality of the person you're working with and how open they are to that and try to shift yourself towards clinicians who are open to providing more information to you, asking for resources that you can read to learn more about your diagnosis. I don't know how do you help your patients with navigating other people in the healthcare system that can be pretty invalidating and I would say difficult when anyone is kind of not following a very specific structure of being how a patient is supposed to be.
Yeah. So it's something that you have said earlier about how you learn so much, and you're humbling, and you're continuing to grow in
Yeah.
understanding, and each
Yes.
patient experience helps
Heck
you
yeah.
understand the next person. I think the saying is for every one person you see who's autistic, you've seen one person who's autistic, but there obviously are patterns to
Mhm.
help understand. I had a patient of mine who found me because of the podcast and has
Mhm.
been listening, and she said, I really love listening and hearing stories. And she's autistic and she has
Mhm.
fibro and she has ADHD
Hello, fellow
and
autistic
RLS.
fibro ADHD person out there in the universe.
And she probably knows who she is talking and listening. Hopefully, maybe we're relaxing while they're trying to fall asleep and not think about their pain. And there's somebody validating them. But she said, and she also had gone down the path of being told there's nothing wrong with you by
Mhm.
the traditional medical system.
Mhm.
And then finally finding somebody who said, wow, we know what's wrong with you. You have chronic Lyme disease. And then went down a path of being on multiple antibiotics for many years. And now finally finding me and coming to me. And she said, I think I've saw 51 doctors before I ever saw you,
Yeah.
and nobody ever could connect the dots. So, unfortunately, yeah, that's the grassroots efforts that I've realized, and part of why the podcast is there.
Mhm.
I hope the people who are listening, ones who are living with this, their loved ones who don't have this really care about their spouse, their son, daughter, parent, cousin, whatever, friend, and they just don't they want to learn more and hearing stories about other people living with this and how to help support them. And then hopefully there are some clinicians there who haven't had a lot of training, but are open to learn more about this. And as they hear you share, like they'll hopefully
Yeah.
reconsider. And then I get a chance to work with residents and
Mhm.
medical students and kind of starting with education to help see that I have a medical student who's just first year and getting a chance to shadow me now about 8 times. And he's seen a lot of these patients. And we had a patient who he's seen a couple times with me who's autistic, has
Mhm.
ADHD, RLS, and has POTS. And she would go to the ER 3 times. And they're like, why are you here? What do you keep coming back for? You're fine.
Mhm.
And I said, you're going to see somebody like this during your rotation in the ER. But you get a chance as a med student, maybe spend an hour, and they may say, oh, that worried 20-year-old, she's just back again. She's
Mhm.
just having, and then to listen, and then you get a backstory and go, hey, by the way, did you know? And maybe for the first time feeling validated because there's not enough understanding. How much training did you get?
Mhm.
Now, are you a
Mhm.
pediatric psychiatry
So,
and got adult, or you
so
got,
in
is it,
psychiatry paths, everybody does a 4-year psychiatry residency. And then if you want to do child, you do a 2-year fellowship. So everybody's adult, but only some people are also child psychiatrists.
so you did a
Yes.
lot of training. So
Yes.
how much, so in your adult, or in both of them, but specifically in your adult only psychiatry training
Mhm.
or primary adult,
Mhm.
how much training did you get on diagnosing adults
Mhm. Yeah.
as with
Yeah. The answer
autism,
is 0.
and then adding the pediatric
Right.
component? I'm guessing that was part of that, but it was geared towards, I would often say, the stereotypical child
Yeah.
with is that
Yeah.
unfair?
Yeah.
I'm
So
guessing that
so
is
I
part of the
think this
training.
dovetails nicely with what you were saying. I think it's so valuable for us to maintain our curiosity as clinicians and be willing to constantly question our assumptions. How I was trained in my residency and fellowship to diagnose autism and also ADHD, by the way, is different than how I diagnose it now, and things change. Imagine being a child psychiatrist who loves treating autistic people, considers themselves a specialist in autism, and then, I decided I wanted to do a really deep dive into autism for a presentation. I give a psychiatry boot camp for the primary care doc and other psychiatrists series online. And I read all these books and I was like, wow, I have been missing autism. I've been thinking of autistic people differently based on how I was trained. And I am autistic myself, right? I missed it in myself. that was humbling. So we need to constantly be learning and willing to adjust our conceptions. And it's true that autistic people without intellectual disability tend to fly under the radar till later in life. Autistic people who have intense empathy, higher empathy for other people's feelings, and may fly under the radar too because our diagnostic criteria are based on a subset of autistic people who had, we call it alexithymia, kind of like color blindness for one's inner emotional states, difficulty picking up on their emotions and those of others. There's a subset of autistic people. And so, of being a psychiatrist who spends like all my time thinking about what other people are feeling and thinking and reflecting on what I'm feeling and thinking and being pretty naturally intuitive about that. I was like, no, I can't be autistic. That is false. Because yes, there are many highly empathic, intuitive, even hyper empathic autistic people out there, and I am one of them. Yes, though spending my free time making fun fantasy-themed psychiatry presentations was a clue that I was autistic that I missed.
So it is a big area that's not being served, and it's not a lot of people out there diagnosis. I am
I'm
left with
hoping we can educate more people. I mean, I love the adult autism. What is it? Hold on, I'm gonna look it up. So Donna Henderson has a book. Let me find these. A clinician's guide to autism. Is this autism? Question mark. A guide for clinicians and everyone else. And then there's a companion guide for diagnosis. Okay.
is that meant
And
for
then
adults as well?
yes. And then there's the Adult Autism Assessment Handbook. Is really good too. A neurodiversity affirmative approach. Those are some of my favorite resources for recognizing and diagnosing autism.
Yeah, I'm left with being aware with
Yes.
younger populations. It's often with TikTok and other social media out there that there are people sharing their stories, and maybe again listening to the podcast and recognizing some of this and then I will use the Camouflaging Autism Traits Questionnaire or the Ritvo Autism Asperger
That's a
Diagnostic
great
Scale.
one. Free
And then
on the Embrace Autism website.
and if in the end, I'm a little cautious about making the diagnosis,
Yeah.
and I
It's
will
a
ask them.
complicated diagnosis.
And I will ask them, "What are your thoughts? What do you think?" I was talking to a psychiatrist at the APSARD ADHD conference, for those who aren't familiar with that, and he said, "Well, what's the big deal? It's not like we treat it with medicine, so whether or not to make the
Right.
diagnosis," which I'm like, "But it can."
It's a pretty big deal.
Well, let me ask you,
Okay. I have thoughts on that. Having been diagnosed this year, I have some thoughts on the significance of this diagnosis in my life.
Yeah. So if you were chatting with another psychiatrist at the APSARD conference and hanging out, and they made, well, what's the big deal? What, we don't treat it.
I
What's the big deal?
do get that too. Yeah.
So what would you say?
Why diagnose people accurately? How does that change their treatment at all and their perception of themselves?
Well, we don't use medication for it.
Yeah, and I have to say, like, the autistic patient themselves is like the biggest collaborator in this diagnosis process. Like, I think of us like two co-investigators, right? I'm like, here's some stuff about autism. Does this fit you? Like, what is your experience like? And like autistic people, some of us really like to research autism. So you can use that and be like, okay, go research autism. Like, what fits, what doesn't fit. Bring it back. Tell me about it. Here's some stuff. Read it, highlight it. Tell me what resonates with you in your life. But the question about the significance of diagnosis. So one of the most positive events in my life was being diagnosed as autistic. Sounds strange, right? But made so many confusing pieces, like scattered puzzle pieces of my history, come together into something that made sense And there's is a difference between, okay, so here's things that Stacy does and ways that Stacy thinks and how Stacy perceives the world, and it's just a weird Stacy thing versus, oh, this is my brain type. And that is why I perceive the world that way. And that is why I offended so many people in residency by accident and struggled so much, even though I was trying so hard to do so well. And I am not a rude, selfish, overly sensitive person. I actually am autistic. I have different sensory needs. I have different ways of emotionally regulating myself. I have different styles of communication and need for directness. And it helped me really understand that I was viewing the world through the perspective of an autistic person. And then I could have more empathy for my husband too. I would be like, oh, so he's not autistic. So it's really uncomfortable for him to just say that directly like that. Got it. I understand. His brain is different than my brain. So I think it really helps with compassion and perspective a lot. Oh, I can't hear you. Hold on.
And I
Oh, you
think
were
it's like
muted.
the puzzle pieces. I like that metaphor of, for many people, it connects the dots as they start to then
Mm-hmm.
investigate and learn more. It kind of makes me think of the question of how many people who were given incomplete or outright wrong psychiatric labels. I've read about how many people who are told they have a personality disorder often may be on the autistic spectrum. And one of the
Mm-hmm.
classic ones is being a narcissistic personality disorder, or and often that's
Or
casually thrown
borderline
around.
personality disorder,
And these that are often pejorative diagnoses
which
is
is
not a
very
lot of.
sad too, because I mean, we could do a whole nother podcast on how borderline personality disorder should not be a pejorative diagnosis. But,
But that's
but
how
yes,
it's often perceived by the community, and nobody,
right.
there's not as much compassion as maybe somebody who has other, maybe eating disorders or whatever. But do you see that a lot in where when they've been through and then recognizing that they're autistic and being aware that that explains things so
Yes,
much better,
yes.
at least
I do experience
clinicians?
that with patients a lot, and they're able to say, "Oh, so you know, what clothing I'm wearing that day, how the lights are, my sensory needs, they impact my mood a lot. There are things I can do to help myself here with emotional regulation. These are the movements that help me with emotional regulation. This is, I've heard, I'm also part of a group called Autistic Doctors International. And one of my favorite stories was one autistic doctor shared about how he set a timer so he could go do emotional fluffing for his front desk, which is basically go like a little small talk, right? And so you don't know to do that if you don't know you're autistic, right? You're like, oh, I'm autistic. So I just am going to, my communication is about information, conveying information. Whereas my front desk, they're neurotypical. So they need small talk, communication that's really about putting people at ease and solidifying a relationship within a social hierarchy, right? And so having that understanding that it's almost like a cultural difference here how I communicate. And so it also enables me to, it's funny because I was already doing so many things that just, it's felt obvious in hindsight, right? That this is why my office manager tells every single new front desk person, Dr. Greeter is very direct. That's just how she communicates. She really cares. This is how she is, right? And you need to tell Dr. Greeter stuff very directly or she will miss it. Okay? No subtlety. Don't imply anything. All right? Okay.
Yeah.
And so I was already doing some of these things intuitively, but just understanding that I'm autistic helps me to do it in a much more intentional and informed way to improve my communication with others. Yeah.
There's a lot of stereotypes of a patient of mine who many patients of mine who have overlapping chronic pain conditions, nociplastic pain conditions, fibromyalgia-related conditions, whatever word you want to use. And often I've been very attuned for many years of recognizing ADHD in
Mhm.
kids, and not that long after in
Mhm.
adults. And as part of my practice, pediatrician and internist, felt very comfortable with recognizing it. And then in the last year, recognizing adults, especially if they didn't come in with the more stereotypical childhood diagnosis. But one of my patients, she said, and she's recognized that she's autistic, and we were talking about it. She said, Dr. Lenz, did you know I was autistic when we first met? And
Mhm.
this was probably 6 years prior. And I said, I didn't know anybody like you was autistic. I never would have thought that it wasn't even on my differential diagnosis to consider anybody with that.
Yeah.
And then she got married, has a child, and who has some emotional dysregulation at times, and her husband has ADHD, and we were talking about how, as she's taking on new foods, and it turns out she likes same foods, tan
Yeah.
foods. They eat a
Yeah.
healthy vegan diet, but there's these certain things, and now she has a self-awareness. And I said, well, there's a lot of this ADHD runs in the family. She's like, oh, Dr. Lenz. She's like a little over 3. She's like, I'm 99.99% sure she's got ADHD and probably is definitely on the spectrum. And what's fun, just talking at the 5-year-old checkup now, how's school going? And she said, the teacher said, wow, she is the most empathic kindergartner by far. And again, that fights the stereotype
Yeah.
that, and like you said,
Right.
you were very empathic, which is
Yes.
just something, that awareness. And so wouldn't it have been nice to have along the way, have a guidebook
I
and then a
know.
mom
It would be
who's
nice.
learning to share some of these
Right.
things.
I think people get confused because it's like not knowing the expected neurotypical social response to someone else's sharing something is not equivalent to not caring about what they're sharing, or not being concerned about what they're sharing, or not even feeling what they're feeling. But often, unfortunately, autistic people not producing the correct neurotypical social hierarchy response is understood as not caring, not feeling, unfortunately.
Yeah, and being misunderstood.
Hmm. Yeah.
So you got diagnosed at age 40 with
Yes.
both fibromyalgia and being
Yes.
autistic. So
Same
do you
year.
mind sharing, I guess they're somewhat parallel paths often, but do you mind sharing a little bit about that story and maybe that some
Right.
of the backstory, especially maybe with the fibromyalgia diagnosis? You've touched on some of the being autistic, but if you mind sharing that, 'cause it usually doesn't just pop up overnight unless you got COVID suddenly and it's unmasked it, so to speak.
I hesitate because I am pro get your vaccine, please. But I did have a very odd, I started to develop fibromyalgia symptoms after my COVID vaccine. I don't know if this affected it, but I got a COVID vaccine and some kind of encephalitis vaccine and a flu vaccine like all simultaneously. And I had already had a wonky nervous system, like neuropathy and a celiac disease, like other autoimmune diseases. And so it started with my vaccination that I started having a lot of fatigue and just achy pain all over. And it was kind of like I got a COVID vaccine and I just felt like I had just gotten the COVID vaccine and it just didn't go away. If I get like a virus or something, it'll be like a couple weeks after the cold symptoms resolve. It'll kind of hit me again. So it seems very like something with my immune system I know is happening. And it lasts like 3 or 4 weeks at a time, where it's pretty significant. And then most of the time, other than those 3 to 4 weeks after being sick, it gets pretty mild again. It kind of is waxing and waning. I notice your book, Conquering Fibromyalgia. I'm still in the process. I have not conquered it yet.
And it's a
It's a
process. And
process. I am
again,
process. I'm in process. Yes. Yes. But I do regular physical therapy, a lot of exercise, staying hydrated, eating frequently, things to care for my body. Like my body is kind of high maintenance. And a lot of autistic bodies are high maintenance bodies. that I have to be really on top of my exercise, really on top of my sleep, my hydration, my food intake.
How long after that COVID vaccine and how many different doctors or visits did it take for you to get the diagnosis of fibromyalgia?
I'm actually probably unique because I probably got that diagnosis maybe 3 months after, 3 months in, and that's like light speed. And I'm really in a place of privilege being a physician and being an extremely assertive physician. I was like in the neurologist office, in the rheumatologist office, in the specialist, like really fast, and was given the diagnosis by my rheumatologist specifically. But I think that for most people, what do you think, Michael? Like 2 years?
It could be 5 years, or many people are going on a lot longer than that. 3 months is light speed, like you said.
Yes. And so I feel grateful. I feel grateful for the privilege. I don't think it would have happened as fast if I wasn't a physician. I know so, actually. It would not. Yeah. I wish it could be that fast for everyone.
Do you think how did they treat you differently besides the speed? Another person who's going through the same process.
Yes, I think that I got appointments much faster with specialists. And I knew which specialists to go to who were good specialists, because a lot of times you go to a specialist and you go to another specialist, you go to another specialist before you get an answer. So being a physician, I could reach out to a whole network of physicians and be like, who is the best rheumatologist for this issue? Who is the best neurologist for this issue? And then advocate for appointments. At the same time, I didn't have nearly as much power as I wish I had. I think I had to wait because I had to wait 6 months for my nerve conduction studies. And I really did try to pull weight to get my nerve conduction studies sooner, but I had in there. And so I think it's just healthcare resources are really stretched. It's really scarce. It's scarce. And I think that I have the benefit of a great husband. I want to give him a lot of credit for like basically being a healthcare coordinator for me. So while I see patients, like he was always like, here are all the blood work, all the records, all the things from the other doctors so that you have them up front, and we're gonna get this done. Most of the credit goes to him.
Yeah. So when you were diagnosed, and it sounds like the rheumatologist is the one who made the
Yes.
diagnosis, and then as somebody who is not familiar with the diagnosis, and so what did they say? What did they say fibromyalgia was? How did they do? What was the
I'm sorry, go
you
ahead.
received? When you received the diagnosis through the rheumatologist, what was the explanation for what fibromyalgia was? What were
I know,
you
they didn't
told?
actually give me an explanation. They're kind of like, we don't really know what it is. It's a diagnosis of exclusion. So, yes, when I first was told I had fibromyalgia, I didn't really believe them, actually. I was like, nah, that's a garbage dump diagnosis. Forget this.
Did your bluntness come
No,
out and
no, no, I
say
kept it to
them?
myself because I was in my like mask because I'm at the doctor mode. Okay. Anyways, but I was like, nah, you just don't know what's going on with me. And so you just called it fibromyalgia. That was my initial reaction. But then I did learn more about fibromyalgia, and I was like, huh. And I was reading these studies, and it was like autistic people commonly have celiac disease and fibromyalgia. Autistic people commonly have. And I have some mild dysautonomia, and I have all the things. So I was like, okay, yes, the symptoms fit, and it does commonly co-occur. I admit now, yes, I own the diagnosis now. I learned about it reading on my own. How do you explain it to patients, Michael?
It is a problem. The symptoms are diffuse body pain,
Mm-hmm.
brain fog, or cognitive
Mm-hmm.
challenges that really many of those fall under the ADHD umbrella, fatigue, and difficulty sleeping are usually the core, and you can have pain in multiple areas of the body that can fluctuate. We know that there's a genetics, there's an environment,
Mhm.
and there's a role of a kind of the pure biopsychosocial spiritual model
Mhm.
approach, and that there are things that if we can start with education. I often say that you're living with this, and the longer you live with it, it's like being blindfolded, bound, and tortured by an unknown assailant without any recourse for relief. When you
Yes.
mentioned the vaccine, I just did a series on long COVID,
Yeah.
and they were predicting,
Okay.
the smart people in the world of fibromyalgia were predicting, in the rheumatology world, it does a lot of the fibro research with like Dr. Daniel Clough from University of Michigan. They were predicting early in COVID, like we're going to have a bunch of long COVID type post SARS, post viral things, because we know from other things about 10% of people will have persistent IBS symptoms after a viral gastroenteritis, for example. About 10% of people after a bad respiratory infection will have, or when I say bad, more than just a minor sniffle, enough that makes you feel achy and run down for a period of time, but they will have persistence. So they anticipated that. And then, what did they see? You have these persistent symptoms that we know that are occurring. So it affects that immune, or not the immune system, but it can affects the brain and how they process pain. So I say pain is an alarm. It's an alert. We need those. But sometimes there's a pain when there's no tissue damage. So pain is
Mhm.
a perception of real or perceived tissue damage. I said it's like anxiety. They're both alarms.
Mhm.
And anxiety is a perception of a real or perceived threat. And unfortunately, it's hard to differentiate between those. And we know that. And then I talk about how one of the things that made fibromyalgia legitimate and shifted it was when functional MRIs showed that this was real. One of the first studies they did was
Mhm.
putting pressure on the thumb,
Mhm.
and
I saw
those who
that
had
study.
fibromyalgia,
Yeah.
yeah. And then there's multiple other studies reproducing that, IBS studies showing similar things, so that
Mhm.
this is the difference. This is now pain and or tinnitus, and a lot of these are overlapping syndromes. And then along with that, it takes a lot of mental effort, and that's where the fatigue.
Mhm.
And we talk about then how much of this overlaps with things like ADHD and autism. We know the effect of sleep. We know the effect of a
Mhm.
healthy diet. It's all of these. I said there's not one thing that we're going to do,
Yeah.
but it's all of these things. And it's a lot harder. But I said we're going to help you, but
Yeah.
we're going to work through this. And like you said, we're high maintenance people.
Right. So what you're saying is not only do I have all the things, I have to do all the things
But you
for
have
my
to know
body
why you have to
maintenance.
do things.
Yes.
And then there's self-regulation. That same mom I was talking, she said
Yes.
she's very fit and has always been very fit. And her and her husband were training for a 100-mile bike fun race kind of thing. I don't know if it was super competitive, but it was enough. That's a lot of training. So very fit. And she's like, Dr. Lenz, my heart rate gets up to 190 and my husband only gets to 140 when we're doing the same. And then I had another patient of mine who was a competitive athlete in college who
Mhm.
realized he's likely on the spectrum, and so is his brother, both of whom have been patients of mine since they were younger. And he's like, oh, when we were in training and doing, in a chronic long swimming, I could easily get my heart rate into the zone because my heart rate went up quickly. And then I'm like, oh, having POTS is that elevated heart rate. For a lot of people, if they're very fit, they don't notice it, that
Yeah.
lack of vagal suppression of the
Mhm.
heart rate is probably chronically there. It's just, notice if you're now dizzy and lightheaded and have these other issues that are going on. But recognizing this, and I like to have a sense of humor. I realize that people who are autistic have a sense of humor, and then they laugh. Meaning, of course, I take care of a lot of people who have brains that work differently, and I say this is a difference in how the brain processes things. And then I'm looking for those neurodivergent, possible differential being either autistic or ADHD, and both, and asking and coming back and talking and saying, you know, we talk about it. I do the widespread pain index, symptom severity score, fibromyalgia impact questionnaire to get a baseline, because often then if the scores from 0 to 100 and had a patient go from 98 to 80, well, that's not a big improvement. You may not think it's better, but now you're going down to 60. And this was a recent patient of mine who we adjusted her pregabalin, which is Lyrica. She was taking it when she went to bed. I'm like, no, take it 2 hours before you go to bed. And then we talked about pacing, eating healthy, and then we
Mhm.
diagnosed also she had comorbid ADHD. We adjusted her Adderall in a short period of time. Her score dropped from a 98 to 60. And she had this, she's at 60, 62. She had these symptoms, very high, hate the word high functioning, but didn't have as many intellectual disabilities, but had a lot of distress along the way. Had a son who had dyslexia and also likely some ADHD symptoms. But she kind of had this sort of half smile. And I said, it almost, and we were doing a virtual visit recently. I said, it's almost like you don't want to admit you're doing well and you can't believe you're doing better, but you're doing better, aren't you? She's like, yeah, I don't want to jinx myself, but I can't believe this is helping. And then we're trying to then implement now, if they have that coexisting ADHD, if they have a recognition that no wonder if I go to a loud social event that stresses me out. And now my husband can understand that stresses me out. So I can only tolerate so much and have support, right? Certain things, having control. And it's not, we don't know a lot about it. I think we know a lot about it. It's just really complicated and it doesn't fit into the simple biomedical model of a process. And it takes a lot of coaching, which is kind of how I fell into this. Is I had a 2-page handout, then a 10-page handout. Then I decided to write a book, finish it in COVID, and then do a podcast to extend the conversation, to bring the attention until more and more people know about it and can get better. What are your thoughts? Is that a decent explanation?
I like it. It's better than the explanation I got anyway.
How did you then get the diagnosis of being autistic?
Being autistic, how to do that. Okay, so basically I was reading all these books on, like I was talking about earlier, Donna Henderson's book on Is This Autism, and the clinical handbook to adult autism diagnosis, and I kept being like, this is weird. Did someone write a book about me? What is going on? So then I was like, okay, I should actually get an assessment done. So I had an assessment done and I made my husband attend to the assessment with me because I wanted it to be accurate. I was like, you got to make sure this isn't just me, that I'm imagining something here. Like, okay, so I do the assessment. I'm like, is that all? Do you agree? Are you seeing the same thing? And he's like, yeah. And it's kind of funny because when I got the diagnosis of being autistic, I was like, oh my God, holy shit, I'm autistic. And I tell my husband's like, yeah, that makes sense. Yep. He's like, I always knew you were different. I just didn't know what it was called. And, now they just have this word for it called autism. Cool. No biggie to him.
Who did you see? You're
For my assessment?
You're in a Sarasota
Yeah.
area, which is, oh, okay.
I did do it online with someone specialized in adult autism assessments.
A group that has a number of that. And I don't know if you end up having a link, because I think
you want some
if there are people who do that.
One of them is a good friend of mine who also does my is playing Rowena Ravenclaw in my Harry Potter autism presentation coming up. But Neuron and Rose Psychological Services, for if you're in California or Minnesota, for example, and she's autistic herself, and that's really cool. Who else? I know that Matt Lowry in Kentucky does neurodiversity affirming autism assessments for adults. The person who did mine,
but there's not a,
I don't
it sounds
remember her
like
name. You kind of have to know someone to get a referral to someone who's really good. I mean, part of the issue is that the more traditional assessments, like ADOS, for example, are missing the not intellectually disabled, higher masking, generally autistic females. Whereas newer assessments, like you mentioned, the RADSR, the MIG-DOS, are better at picking that up.
Would you put CAT-Q in that as well?
I'll tell you who did my diagnosis. Amy Marshall did my diagnosis officially.
And she's connected with where?
Where is she? Good question. Let's find out.
A psychologist.
Residence. Interesting. Yeah, she's a psychologist. I'm trying to figure out where she's located, but I did it virtually. She's online.
Sure. And it sounds like there's a big need.
Yes.
For recognition of this.
But here's the thing, people are really vulnerable, and so you could just go to any old psychologist and like, no, you're not autistic. So I think it's really important to go to someone who is specialized in adult autism assessments. I do them myself as a psychiatrist, but it's hard to find. And so a lot of people self-diagnose because they don't have access to that resource.
Yeah, and it's that validation if you share
Yes.
that now with others
Mhm.
on the
That'd be
podcast
fun, huh?
to get that because I'm like, "Oh, here's somebody."
Yeah.
I did get Dr. Matt Zakreski, he's in Virginia and also works, I think, a little more geared towards pediatrics and making sure the
Mhm.
kiddos get the resources they need and recognition than necessarily adults, but as he himself is autistic and also has ADHD, he's understanding and aware of that, but that's where his
Mhm.
emphasis is. But as I'm reading about this, is there is sometimes these stigmas like can somebody can be autistic and actually do mental health? Can they really be a psychologist
Yeah.
and or a psychiatrist? Have you read or
Mhm.
heard some of that? What is what are your thoughts
Yeah.
in regard to
I mean,
that?
I worried about that myself. Maybe that's part of why I was like not wanting to even consider being autistic because the idea was that your interpersonal skills are less than if you're autistic. So who's like, "Oh yeah, I want a psychiatrist who doesn't have interpersonal skills or empathy." What? So okay, so so I think that is some of the my colleagues who I have shared that I'm autistic, it's been hardest with fellow psychiatrists because they're operating on under some of these, I would say, old myths about autism. Whereas, ironically, being autistic and being like a detective about people and very fascinated by what's going on with people who think differently than me and act differently than me, I think has made me in like intuitively I've been doing psychiatry my whole life. Um, I think that there are many reasons that the medical profession attracts autistic people in particular. The medical profession attracts people who are detail oriented, really curious, and like to do a deep dive into their special interest in their information rise. Right. So, as a psychiatrist, I actually feel the most at home and the most interpersonally at ease because when you're doing psychiatry, social norms, social niceties, they don't matter really. The more transparent, authentic, open, and direct you can be, it actually goes quite nicely in psychiatry. Because if I can be very transparent, non-judgmental, and open, then it helps the patient to be that way. I'm just kind of naturally there isn't really like, social taboos don't really impact me that much. Social norms don't really impact me that much. And so that can make for a much more natural, authentic, and fluid type of psychiatry for me personally. And so ironically, I think that I love doing psychiatry and do it really well in part because I'm autistic. And that's why I feel safest doing psychiatry. Because you're relating so much differently than you do when like you're making small talk at the grocery store. That annoys the hell out of me, right? Like, oh, the weather is this, and oh, what are you having for dinner? Because you're buying these eggs, blah, 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 blah. But like the real stuff, right? Okay, so you feel this deep shame because of X, Y, and Z. Yes, let's talk about that, right? Let's do that. That's the kind of communication I can do.
Awesome. I'm
Okay.
going to ask you a question
Uh,
is about the psychiatry is this upsets the apple cart, I think, within the world of psychiatry, autism and this traditional.
all right, cool. That's okay.
Okay. When you were talking about that with other maybe traditional psychiatrists,
Yeah.
is that maybe autism or being autistic is not part of their even framework of a consideration of this even being part of somebody's mental health,
Mm-hmm.
and that you're interjecting this does change, I think, the paradigm in understanding somebody, and so much of being autistic overlaps with
Mm-hmm.
mental health issues. Any thoughts on that?
Okay. I'm not sure if I understand the question completely.
It's more of a comment
Okay.
of observation of for people, for
Yes.
your peers that have a traditional stereotype of what autism
Okay.
is that now you're interjecting
Mm-hmm.
a different paradigm
Mm-hmm.
for understanding mental health,
Yeah.
especially in reconsidering that they may not have made the right diagnosis or completely the full recognition, especially if and is how many of those maybe stereotypical or traditional adult psychiatrists have ever even made that diagnosis
I know.
in any of their adult patients to be
I
a
think
huge
it's
part.
part of their rubric, but I think maybe they're seeing the more traditional, closer to DSM-5 definition. I don't, and I think another thing that's a big paradigm shift is that someone can be a thriving, very happy, enjoying their autistic self, not trying to be neurotypical. It doesn't mean, I say autism is a great blessing and a curse at the same time. Right? I love my doing a deep dive on a regular basis into my special interest of psychiatry. As a psychiatrist, I get to info dump all day about psychiatry that I love talking about. And so there's a lot that autistic physicians bring as strengths to the table. We're awesome at pattern recognition. We love solving puzzles. And then there's a lot of pain that we go through. I think residency and fellowship were really painful for me. I think that there's the need to figure out how to mold how you are talking to people, different attendings in different ways on different rotations, right? And being autistic, part of being autistic for me is I just naturally talk to people the same way, irrespective of where we are in the social hierarchy, which my patients love. They feel like, wow, Dr. Greeter just, talks to me like we are collaborators. But that doesn't go well when it's certain attendings and certain hierarchies who expect you to say a certain thing or a certain tone or a certain, you know what I'm saying? Modify. And it's really hard. It was really hard for me being autistic to figure out what different authority figures wanted from me because you're kind of supposed to figure it out without them actually saying it, what they're looking for.
Yeah.
So I love practicing psychiatry, but I will say that medical training in many ways was pretty miserable. And I do want to do more. I'm trying to do more to support autistic and ADHD doctors going through training so that we don't lose them and we can keep them and what they bring to the table.
Yeah, and I know we were talking before we went on, you get a chance to work with teaching the
Hmm.
local family practice doctors, and
Yeah.
obviously this is part of a conversation that is important, and probably the younger doctors coming through are a little more aware of these and open to
Some of my
understanding or know that
residents I have
perceptions.
diagnosed as neurodivergent.
Yes,
It happens.
I won't put this on the air, but doctors that work with me
Mhm.
and med-peds doctor, within a couple months, we're seeing all these workups that we do, and he does all the
Yeah.
questionnaires. Just like if you were doing all of these
Uh,
RADs and ADQs, you're like, wait a minute. And I use a DIVA questionnaire now and very deep dive. And I'm not his doctor,
right.
and I think he's very intelligent, but I'm in 2 years in, year and a half in, or so he got his diagnosis and got put on Vyvanse for ADHD, and he's
Mm.
probably a little bit on the spectrum and whatnot to some degree, not to be your child's doctor or
Right.
their doctor, but it's kind of an awkward situation where, especially if they're another doctor in training, you can start to, they might connect the dots. And you were sharing that as an affirming diagnosis, not to be
Hmm.
ashamed of, is
Yeah.
that, and as you said, other physicians getting into this, you look at some of the subspecialties. Oh, my grandpa was a nephrologist. Talk about specializing and special interest. You get to learn everything there is about kidneys, and that's your thing. I have a family where I care for, and I haven't seen the child whose grandma's the guardian, but he loves everything about human organs, and he's like 6, and he knows everything. I'm like, he is probably going to ace the boards, and he's going to maybe be an organ transplant surgeon, or who knows, some whatever. But we need people like
Yeah.
that. It's a little weird if he's talking with his peers in first grade all about livers and hearts and intestines,
Yeah.
but that's okay.
I
Is
tell my
that
patients, I'm like, you will find your place someday. It's just not in the formal educational system.
well? And that's actually where I had a recent patient who's going to be going to middle school next year, and she's kind of the whole family is simultaneously getting diagnoses being autistic and having ADHD and to some level, and the looking at doing virtual school for middle school because the hyperstimulation of a big middle school and annoying boys in the class making annoying normal
Mm,
boyish kind of things, but it's too much stimulation and it's stressful and it's hard to sleep if you're worried about the overstim and during the day, and they're looking
yeah.
at, but they're aware, and I said, mom's recognizing that she didn't know this. Her daughter's going to have a much better chance, hopefully not go through some of the struggles that can lead to chronic pain issues
Yeah.
because she's getting recognized at age 9.
Right. Hoping the
Um,
younger
and-
generation.
yeah. But any last thoughts that you'd like to share for those out there? Again, there's the 3 targets, those who are not everybody who is not everybody who has fibromyalgia is autistic or has
Right.
ADHD, but it's a higher percentage. Finishing for those who are struggling with that, and they may be wondering if they may be autistic. We mentioned a couple
Mhm.
scales that they can do. What are maybe a couple bullets, or not couple, but some bullet points or patterns that may be clued in that they might be autistic to start maybe with
It's a
that
hard thing
in
to
a
summarize.
well, and that's why, and it won't
Uh,
probably go as many minutes as you have, but I think it's an important question because we've been talking about it. But what are some of those things if you were giving this to a family practice group or in wanting to be informed lay group
right.
to understand this? How would you explain it to them?
How do I know I'm autistic? Okay. All right. That's what Michael has ordered. Yeah. Okay. Autism includes sensory differences. So you may notice that certain lights, sounds, touch, either you need a lot more of it than other people do, like you need to rub something that's soft a lot, or it's too much for you, too intense for you. The lights are too bright, this noise is too much. I can't stand food of this texture. Your sensory system processes things and reacts to the environment different than a neurotypical brain does. Another part is your style of communication. Autistic people tend to connect through sharing special interests and want information. They want to connect through sharing data and tend to have more direct communication style. They like a lot of context. They may offer a lot of context for clarity, not as great with context implied in the conversation. Autistic people tend to find stimming, like repetitive movements, very soothing. That's an indicator. And autistic people may have certain routines that they find very soothing to them. They want to eat the same foods, or they want to use the same routine for getting ready in the morning. And then when there's a surprise, to do surprise, new thing, change in routine, that can hit you harder when you're autistic, for example. Also, autistic people like to do a deep dive into information and tend to be very creative. seeing things differently, great at picking up on patterns, very rational and logical thinkers.
Very good summary. And maybe to finish, too, what are some thoughts of encouragement? Again,
Okay.
kind of three target groups. One would be those who are living with fibromyalgia and maybe neurodivergent as
Hmm.
well. And then their loved ones who may not have a
Hmm.
brain and body that is those struggles and
Hmm.
speaking to them. And then for all the clinicians, whether that's doctors, physician's assistants, psychologists, therapists out there in the world that are coming interacting and crossing, whether directly or indirectly, this population. So maybe starting with
Okay.
those who
Okay.
are living with any words of encouragement as we wrap up our talk here.
I think, first of all, we don't get to choose our brains, bodies, neither our central nor our peripheral nervous system, unfortunately. But, and we don't get to choose our psychiatric diagnoses either. Darn, it's not a choose your own diagnosis adventure this life. However, we do have choice and agency in how we live our lives and what we do about our diagnoses, whether we seek support, connect to other people who are like us, and find people who really see us and understand us. So, remembering that suffering is universal, but suffering alone is optional. And I am out here living my life with my very special brain and body, my ADHD, fibromyalgia, and autism. And I, at times, hate being autistic and ADHD, and other times I love it. So I would encourage everyone to really try to have compassion for themselves as you are just doing the best you can. I use an analogy of going to the gym, and it feels like, God damn it, everybody's lifting heavier weights than me. I must be so weak. And then you finally realize you're like, okay, well, on the outside, their weights look heavier, but actually, like they're lifting 10 pounds and I'm lifting 15. So when you have these challenges that aren't visible to the naked eye, right? We tend to think, oh my God, I'm so weak, but you're not weak. You are carrying heavier weights than others, and give yourself compassion.
Awesome. If
Oh,
they're
for loved
listening.
ones. You have to ask my loved one because he's an awesome loved one. He's the epitome of the great loved one. And he can teach all the loved ones how to be loved one, just being with them, just having the courage to be with them and their pain and their struggles is so powerful. Like loved ones think they're helpless or they're not doing anything, but just to be there, to not be alone with something is a very, very powerful thing that you are doing for your loved one.
And being in understanding, getting
Yeah.
educated and validating just because they may not feel it's sensitive or they have to give the right supports that they need to go to bat and help.
Yes, it takes courage to be like, this is bad, this is painful, and not try to sanitize it or minimize it. To just really be able to meet someone with their pain and suffering takes a lot of courage.
And unfortunately, for many people, they may not have had that understanding. Spouse and may have gone through a divorce because they were
Yeah.
blamed for these struggles and then
Yeah, that's
later
really
find
sad.
out.
Yeah.
And I'm sure you've seen that in your practice
Hmm.
when you're recognizing this. Any thoughts for the clinicians out there who, physicians and other clinicians,
I always
any
said, like, stay think that you have it all figured out. And that's the beauty. beauty of being able to practice medicine, especially psychiatry, man. Gosh, it is, we will never run out of more to learn. Yes, it is endless.
Yeah, I agree. I remember having a mentor in my pre-med in med school said, half of what you learn changes every 7 years. And unfortunately, it takes somewhere like 14, 17 years for something commonly accepted to be routinely practiced.
Right.
But
Yes.
suddenly, when you shared your story to your fellow psychiatrist, you didn't go, oh my goodness, I have to re-examine all of the files.
Right.
Every new patient comes in, I'm going to do the
Yeah,
RADS
I
questionnaire to
need
see
to
if they have
really
homework.
re-examine all of my preconceived notions about autism.
Actually, it just takes a curious mind and asking a few posing questions like, hey, I'm
Right.
just curious, have you ever such and such?
Yeah.
And sadly, one of my patients shared with me today, and I won't have this on the podcast, who she clearly knows she's autistic. 99.99% feels she has it, did the RADS and the CAT-Q and has
Yeah.
ADHD and the thing. She's like, she went to a psychologist who supposedly mentioned this on there, but she works with kids in the stereotypical ADA system and of recognizing it. And she's like, she's kind of said, well, I thought I was autistic after doing the traditional psych eval. Like, no, you just have ADHD. And then the psychologist's like, well, what if I was in the corner and I kind of was like looking like this? What would you think? Well, I think you were upset or sad about something. See, autistic people wouldn't know that. And she's like, no, you don't get it.
Yeah.
It's a
No.
stereotype. You know that, which is sadly, most don't know that. And then you have to reconsider, which means I got a chance to talk with Dr. Ellen Littman, who was at the APSARD, met her there.
Yeah.
She said that she was giving a talk on ADHD and girls and women. And one of the doctors said he went back through all of his charts to re-look at all of the patients and going through in its career. This was somebody later in its career who had to reconsider when was open to that. She said that'd be awesome if that's the reception. But for some reason, these two diagnoses are very slow in the uptake. I don't know what your perception is within the family practice doctors you are working with. And sometimes in the world of family practice, unlike maybe, I don't know if you've run into a lot of med peds, we're like deep divers of everything. We want to know everything about peds, and we knew we weren't going to do OB, and we wanted to get double boarded. So who would want to learn all of that? And we
Right.
recognize longitudinal stuff. And sometimes FPs are like, I don't know, anything that speaks beyond major depression and SSRI, I don't even want to touch it. I don't want to, unless they personally are somehow got interested in it.
I think it's growing. I think I think the younger doctors, the residents, are more and more interested in psychiatry. I do think that, and learning it, and by necessity, because there is not access to enough psychiatrists. One of my goals and why I started the psychiatry bootcamp presentations on my website, which you can find on stacygreetermd.com, like STACYGREETERMD.com. I started them to try to empower more family med peds primary care docs with psychiatry information because we're really on the front lines of noticing these patients, of being able to see them. Yeah.
Awesome.
An accurate treatment starts with a really, really good differential diagnosis.
Yeah. Yeah. Thank you so much for taking so much time
Thank
here
you.
on this
It was
lovely
fun. It was great talking to you,
evening.
Michael.